As a frontline emergency physician taking care of the uninsured and the underinsured, I have seen firsthand patients coming in a coma due to their diabetes that wasn't taken care of, or in respiratory failure, having to be put on a breathing machine because they couldn't afford their medications to take care of their pulmonary illnesses. This is catastrophic, and President Trump should be taken at his word. We should all raise the alarm. This would lead to 40 million Americans having their health insurance taken away, including 5.4 Latinos, and it would raise the uninsured rate of Latinos by up to 30% of the total population. So this is very alarming for the American people.
You know, when I saw this headline, part of what occurred to me, Congressman, is that there has rightfully been so much emphasis on all of the promises former President Trump has made should he come to power again, right? A desire to use the power of the federal government to go after his enemies, a very slippery slope into autocracy. Behind all of that, there's also a reminder, given that he has no real unified ideology other than a desire for power, that there are systems in place like the ACA that are working and servicing Americans that he also wants to dismantle. One has to imagine the ACA is not the first and the last piece of working U.S. government policy this man would want to do away with.
I agree with that. And what's really worse is that you got 150 million people in our country who have chronic illnesses who would be discriminated against due to having a pre-existing illness if the Affordable Care Act was repealed, and they would be charged more. The cost of care would increase because premiums would go up. You would have junk plans that wouldn't cover anything, and therefore you would have higher out-of-pocket costs. In addition to that, you can say goodbye to all those essential health benefits like mental health care that's mandatory in health insurance, and then they would slash the protections from catastrophic medical bills. I mean, this would really hurt the American people's bottom line and their pockets, especially when the cost of living is so high right now. Now, on contrast, President Biden has decreased the cost of premiums by expanding the Affordable Care Act. He has also decreased the cost of insulin to $35 a month, capped the cost of medications for seniors to $2,000 a year, and allowed Medicare to negotiate drug prices with pharmaceutical companies for the first time ever, which will lower the cost of medications in our country. So you have a clear choice this year: the extreme agenda based on politics, or pragmatic, putting people above politics, lowering costs, and protecting and expanding health care for all.